Hello, everybody. This is James, and today we are using another simple medical mnemonic to memorize the chronic complications of diabetes mellitus. So, not wasting much time, let's get started. Diabetes is an independent risk factor for cardiovascular diseases. Risk factors such as coronary heart disease, atherosclerosis, prolonged hypertension may lead to a diabetic cardiomyopathy, which can cause myocardial dysfunction and speed up the progression to congestive heart failure. Now, let us do a bit of some comparison. It has been shown that patients with diabetes with a concomitant cardiovascular disease will have the worst prognosis when compared to patients with cardiovascular disease alone. According to some studies, the mortality for stroke has a three times fold increase when compared to those without diabetes mellitus. A source from the American Heart Association quotes 13% of patients with diabetes mellitus older than 65 years old have sustained a stroke. So we then clearly see that cardiovascular disease is one of the leading causes of mortality and morbidity in patients with diabetes mellitus. Hence, we must encourage preventive measures by supporting adequate control of glucose levels in the blood. Diabetes may lead to obstetric complications such as hydramnios, fetal macrosomia, persistent pregnancy, or even spontaneous abortions. Renal complications. Just imagine 35% of new patients that begins a renal replacement therapy actually have type 2 diabetes, and the mortality may be high for such patients above 20%. But diabetes mellitus with a concomitant cardiovascular disease is still the leading cause of death among patients with end-stage renal disease. Diabetic nephropathy has four phases: microalbuminuria, that is 30 to 300 milligram per day; macroalbuminuria is greater than 300 milligram per day; nephrotic syndrome greater than 3 gram per day; and of course, chronic kidney disease. Diabetic retinopathy is one of the leading causes of blindness in patients with diabetes. Let us take a look at the stages. Mild non-proliferative, we see microaneurysms and hard exudates. Moderate non-proliferative, there is hemorrhage as well as cotton wool spots. Severe non-proliferative occurs with prominent hemorrhage in most of the quadrants, as well as venous bleeding and vascular abnormalities. Proliferative is synonymous with neovascularization, and blindness may occur. Macular edema, glaucoma, and cataracts may also be seen. Now, regarding glaucoma, this is a common cause of blindness worldwide, and in diabetes mellitus, there is remodeling with fibrotic tissues that changes the structure of the trabecular meshwork within the iridocorneal angle, which is the major drainage outlet. Hence, there is an increased intraocular pressure. Cataracts may also occur as a result of the intracellular accumulation of sorbitol, which leads to osmotic changes. There is a swelling of the lens fibril and degeneration, and hence cataracts. So the take-home point is to prevent this devastating chronic complication by screening as well as maintaining an adequate glucose control. Neuropathy. This may take the form of a peripheral neuropathy which presents with loss of sensation or a burning or shooting sensation in a stocking and a glove distribution. The loss of sensation may lead to the inability to recognize a sustained injury that may evolve into a Charcot joint, which is a complication of a diabetes related neuropathy. Motor impairment distribution may also be distal, proximal, or a localized weakness. This may present as a combination of both sensory or a motor impairment. Autonomic neuropathy affects the regulation of the internal organs, and this may present with symptoms such as constipation, urinary incontinence, sexual dysfunction, dysregulation of sweat glands, changes with the blood pressure or the heart rate, but there may also be a hypoglycemia unawareness. Skin. Now, sheen spots, also referred to as diabetic dermopathy, may also be seen. So here you will see a reddish brown or a pink round patches on the sheen. Acanthosis nigricans. This is a thick velvety patches in areas with skin folds such as the back of the neck, armpit, or even the groin. necrobiosis lipoidica diabeticorum. This is a rare granulomatous skin rash that may be associated with diabetes mellitus, commonly seen on the shin, and it may start as a papule which progresses slowly into a patch of rash with a red rim. Ulcers may also be seen as well as gangrene that may necessitate amputation. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.